Welcome everybody to today's Penn AI Tech webinar. Penn AI Tech is the Penn Artificial Intelligence and Technology Collaboratory for Healthy Aging, an initiative funded by the National Institute on Aging. Today, we're very excited to have with us as our webinar speaker, Dr. Curioso. Dr. Walter Curioso is a physician, public health expert, and biomedical informatician with over 2 decades of leadership across academia, government, international organizations. He holds a Ph.D. in Biomedical Informatics and a Master's of Public Health from the University of Washington, as well as a medical degree from Universidad Peruana Cayetano Heredia in Lima, Peru. Dr. Curioso is the Vice Provost of Research at Universidad Continental in Peru, an affiliate professor in the Department of Biomedical Informatics and Medical Education at the University of Washington School of Medicine. He's a fellow of the International Academy of Health Sciences Informatics and a member of the National Academy of Medicine of Peru. His extensive career includes senior public health leadership roles in the Peruvian government and international consultancy with the World Health Organization, the Pan American Health Organization, the United Nations Economic Commission for Latin America, the U.S. National Institutes of Health, and the Inter-American Development Bank. We're really thrilled to have him here today and have him talk about his work. I want to remind our attendees that you can use the Q&A feature on Zoom to post any questions you may have for our speaker. And upon completion of his presentation, we'll have an opportunity for Q&A. So without further ado, Dr. Curioso, I'll hand it over to you.
Thank you so much, George. I'm really glad to be here at this seminar at UPenn. I'm looking forward actually to visit UPenn very soon, but this time will be with a webinar. And today we'll address a very important and a very interesting topic about the use of artificial intelligence to support healthcare systems, particularly in low and middle income countries. Let me share my screen, please. Okay. Are you looking my screen? Let me see.
We're looking at the presenter mode.
Okay. Okay, how about now?
Now we're looking at the full screen of your presentation.
Excellent. Thank you so much. Okay, so, well, George already provide a very nice presentation of myself. Today, in this presentation, I will share some of the experience that that I had both at the academia level and also as experience in the public government, which I spent almost 10 years, and also some of the experience of some of the Latin American countries on my role of advisor and consultant for the Pan American Health Organization and other regional organizations. So as George mentioned in the presentation, so I'm based right now in Peru. I am the Vice Provost for Research at Continental University, which is a private university located in Huancayo, in the central Andes of Peru, but also have some campus in Cusco, in Lima and Arequipa. So I hope that someday you can visit us and we will be more than happy to show you the university and the projects that we are working on. We have 5 schools. We have a health science school. We have medicine, nursing, odontology, medical technology, and several other careers. Okay, so first we will try to share some of the context about the challenges that we are facing when we talk about healthcare systems in low and middle income countries. So actually we face a lot of challenges. One of the main challenges related with the infrastructure. So we have a limited infrastructure. Besides, we can have internet access in the urban areas, but especially the rural areas that are most they have lack of truly and access to the internet connectivity, and also we are facing some shortage of technological resources, mostly in terms of hardware and software. But not only infrastructure is one of the problems, but other problems that we will also see in the next slide is regarding the data. And when we talk about artificial intelligence, of course, we are talking about data. And data is a critical resource and input that we still need to work a lot in, in low and middle income countries, because main of the data and main of the information that we use in hospitals and in healthcare centers are of poor quality, because most of the time they have been using paper-based collection data. But not only this, we also lack of standards, and this is a critical issue for interoperability. And also we face some insufficient funding and financial constraints. And one of the important, and I truly believe that is a critical component, is the workforce shortage. We lack of physicians in many parts of the regions, in Peru and also in other Latin American countries and other countries in the world as well. And not only that, the other main issue is that we lack of specialists also. And if we have specialists and if we have doctors, those are mostly concentrated in the urban areas or in the capital of the countries. And also, and this is a very special condition, or a very special condition that we need to take care and pay attention, are all the sociocultural barriers. Even in one country, we can face and we can see several sociocultural barriers that might affect the assisted adoption of any technology, including artificial intelligence. And finally, but not less important, are the lack of national health information system policies and strategies that we need to take in consideration when we want to deploy and expand technologies. And also, we face and we are facing also right now in Latin America and several other countries a very important political instability that also they affect the healthcare sector, they affect the healthcare system, and of course they affect the health information system as well. Looking more into a deep vision, we will share in this slide how the situation of health information system, especially in Latin America, and this is a framework, is actually the Health Information System Maturity Model that was developed by the Pan American Health Organization. And they classify the maturity model in 5 stages, from the low maturity model, number 1, up to number 5, which is actually the most advanced and the continuous innovation, and that has all the components integrated. Besides, this is the maturity model, we are sharing the main results of this evaluation that was conducted by the Pan American Health Organization. And as we can see, almost half of the countries in Latin America still are in the phase 1 of the maturity model. Saying that, many countries are basically just starting with some kind of digital data collection. So we have a huge opportunity still in countries like Latin America to develop and to integrate health information systems. However, we have almost a little more than 30% that countries that are transitioning from electronic systems to some kind of standardization. So as we can see in the next slide, we are seeing countries that are implementing electronic medical records and some kind of telehealth also platforms, but most of them are not, they don't have interoperability with other local system, regional system, or even national systems. So interoperability is still in very immature models. So that's also very important, because if we want to deploy any kind of technology software, including artificial intelligence solutions, those needs to be integrated with the existing health information systems in the countries. So if we don't have a good national electronic health record, if we don't have a good interoperability hub in our countries, then all the solutions, all the software related to artificial intelligence will operate it in isolation. And that might be limited, because we don't have we have all the conditions of the ecosystem to develop and to implement and to expand. So these are some of the numbers of the analysis of how is going Latin America, most of the Latin American countries regarding health information systems. So as we mentioned, still we have health information systems that are isolated, fragmented, underfunded, and underused. In terms of laws and regulations, which are very important, still only 11 countries that represent less than half of the countries in Latin America have laws and regulations that define and validate electronic medical records. And only 14 countries, quite of half of the countries, they do have a digital health strategy. So not only we have regulations, not only we need laws to boost and to encourage the implementation of health information systems, but also we need specifically digital health strategies in countries in all the world. In Latin America, we have been working on digital health strategies, national digital health strategies in the countries. And we will share in the next slide a framework that we developed initially in Peru back in 2012, that represents a framework model based on existing model, mainly the ISO, an ISO regulation on health information system, that actually was a very important component of our digital health strategy, to realize and then to see which are the main components to implement and to strengthen a health information system. And back in 2012, we call that a digital house, because actually we have components, no? We can see that as a building block model, no? In which we have in the base, we have the infrastructure, right? We have the internet connection, we have the computer, we have the hardware, we have all the necessary components regarding infrastructure and all the technological components. But then we have another layer when we call the infrastructure. And this is a critical component to work and is still working, not only in Peru, but also many of the Latin American countries as well, which is called the infrastructure. In the infrastructure, we have first the component of all the process or the workflow. We have the component of standards and all the health information standards that we need to connect and communicate all the different systems and applications in the healthcare sector. But in the middle, in the center of the infrastructure, we have the electronic medical records. So we truly believe that if we want to work with or develop or implement artificial intelligence solutions, first we need to work on this framework. We need to work on infrastructure. We need to work on infrastructure in the middle. We need to develop and implement and deploy a on a national scale, the electronic medical record. These are the main important components and the main important policies to implement, especially in our countries. Then we have in this layer of the infrastructure, we have the interoperability, which is also very necessary not only to connect and to communicate with telehealth systems, but also with the artificial intelligence solutions. And then we have all the components regarding the digital applications and solutions that will connect, and the services we need to connect the infrastructure with the infrastructure. On your right, you are seeing a very important column that is called the governance and the management, which is critical because we need the support from the main top organization in the public sector in our countries, usually the ministries of health. They usually have at least an office of the National Office of Statistics and Informatics, which usually have now a digital health office. And this is very important, but because we need from the government, which is not only the laws and the regulations, we need the financial also, the financial component to support an implementation of the national hub for exchanging electronic medical records. We need the national deployment of internet access. So that is mainly being taken care from the government. Not only the Ministry of Health, because they communicate also with the Ministry of Transportation, with the Ministry of Finance, and so on. And we need the management component. We need also the financial model. We need the incentive model also, because all of this implementation implies all the change management, and all the components of the change management we need to take care very carefully. And in the other column, we see here the people and culture, as I mentioned before. Culture is super important in all the organizations. And in people, we are considering not only the health professionals, and the health professionals, not only the frontline healthcare workers, which they are going to use all the technological solutions, components, electronic medical records, and so on, but also we need to take care of the decision makers component, because they need to understand what is digital health, what are the benefits, but also the limitations of artificial intelligence solutions and applications, in order to promote and be supporters of the strategy and the applications. Otherwise, they will resist to the change, no? Which is actually one of the, or they will actually don't care about digital health plans and deploying of artificial intelligence solutions. And when we talk about people, we are also consider patients and the public and the general public, because they also are currently using, even with their cell phones, even with WhatsApp, and they're exchanging some medical data, and they are using also cell phones to for health promotion or for other processes. So people and culture are a critical issue. We may have the best internet connection, we might have the best software, but if we don't properly train our healthcare workers, if we don't properly train our decision makers, and if we don't properly train and promote the use and work on digital literacy on our patients and public sector, the strategy will fail. So this is more in deep the digital health framework. We are not going to also review all the components, but I think it's clear that we need to take in consideration a framework model to support and to improve health information system. And this framework is very useful for decision makers because they quickly realize which are the main components. Still, we are still looking for directors and leaders that are still thinking that implementing an artificial intelligence solution is just open the box and then deploy the solution and they will magically appear, or the data and analyzing the data and integrating with and using and extracting the electronic medical records and so on. But that's not the reality, you know? So the reality is that we are facing with a complex ecosystem, because this is a complex ecosystem, and we need to carefully take in consideration all of the components in order to deploy a strategy that actually can impact in the quality of life of our patients and our healthcare professionals. So the reality is that, you know, it will be easy to start this from zero, from scratch, but that's not the reality, because the reality is that we are already in all of our countries, we are facing still with these paper-based forms. This is a real picture from a real healthcare center in Peru. And we are still dealing with all these paper formats. No, we are not only dealing with the paper-based forms. We are also dealing with all these paper-based archives, and we need to actually not only being an architect of digital health, but also trying to build and trying to strengthen a digital house with all of these components in order to be successful. So this framework that we developed in 2012, when we were working at the Ministry of Health, now they are using in the digital health agenda. This is in your right, you will see the digital agenda for the healthcare system that is actually being approved, and this regulation was just expanded until 2030. And as I mentioned, it's very, very, very similar as the one that we approved in 2012. And this is a very practical framework that now the Inter-America Developing Bank is using as their model to support and to recommend and to support the developing of national digital health agenda for other countries in Latin America. So, for example, the Inter-America Developing Bank helped Argentina using this framework as a digital house to support the Argentinian digital health agenda. And also the World Bank also is using the digital health agenda framework to support other countries in the world. Okay, so as I mentioned, before or in parallel, we are designing an artificial intelligence solution. We need to take care of what is going on, and we need to do an assessment of our maturity model of the whole health information system and the ecosystems in order to see what are the weaknesses, what are the gaps, in order to implement an artificial digital health solution. Okay, but what is the situation of developing artificial intelligence solutions and applications in low and middle income countries? I would like to share right now some of the results from this systematic scoping review that was published in Nature Digital Medicine. This is an open access article, and they review literature until 2021. From 2021 to 2025, actually, there are more right now applications and there are more papers evaluating the impact of artificial intelligence to support a healthcare system. However, I think those are, this paper actually highlights a selection of 10 papers from developing countries that are showing how artificial intelligence solutions are helping some of the conditions and some of the issues regarding healthcare systems. So in this systematic review, they selected 10 papers. 4 papers are from China. From Latin America, they selected 3 papers. Those are real world applications. This systematic review doesn't consider proof of concepts or anything that didn't have been related with AI implementation. So these are real AI projects that have been conducted in low resource settings. So 3, as I mentioned, one project from Ecuador, one from Mexico, one from Peru, one from India, and also one from Malawi. As I mentioned, the systematic review only covered papers until 2001, so almost half of the papers were before pandemic. 6 papers were from 2020 and 19, one from 2016, and one from 2017. The situation actually changed after the pandemic, and we will talk this later. And I would like to show that also of the 10 papers that they selected for this systematic review, 4 of them were related to non-communicable diseases, 3 of them with communicable diseases. Still, infection diseases are one of the most severe conditions in low and middle income countries. So still well facing with problems with, for example, tuberculosis, cholera, pneumonia, etc. And also almost half documented experience from diagnosis or screening. And this is still true up to now. Most of the projects regarding artificial intelligence in Latin America are related with diagnosis, which is something similar also from most of the research regarding applications of artificial intelligence in other settings. In terms of the specific conditions, and this is the last table that I would show from these systematic reviews, this is very interesting because it's analyzing the application of the artificial intelligence tool with specific conditions. As I mentioned, this systematic review only covered until 2021, and actually one of the papers they selected of the use of CT computer-aided diagnosis for COVID, analyzing the chest CT scans. The Peruvian one actually showed an implementation of an artificial intelligence that I will also talk about specifically this project in the next slide. One of the papers was related about cancer treatment. One paper was based on breast lump triage. One of them related with a chatbot doctor, and one of them related with clinical decision support system that actually this is a very interesting feature that actually can be very useful to add value to the electronic medical record. So one of the most powerful opportunities for our countries in Latin America are using or developing decision support systems to give value to the data, all the data that we are collecting in our medical records and in our electronic medical records. But the other feature interesting from this table is that also they're classified as a strength or as a weakness regarding the application of the artificial intelligence technology. And as we can see here, one of the important features when we talk about healthcare information systems are the benefit of the potential use or the potential benefit of technology to improve workflows. And we can see that at least 3 projects showed positive results regarding the improvement of the workflows of the healthcare system, which is actually very good and is a feature that artificial intelligence solutions might develop in the future as well. The other important issue when we talk about technology systems or when we talk about digital health software is that needs to be user-friendly. No? We all know all the recommendations about developing software and the utility of developing user interfaces, but only one project here actually showed positive results regarding the artificial intelligence used to be user-friendly. And this is kind of a very important recommendation for developing software in our context. The other important point that actually none of the 10 papers showed some results are the local context, which is, as I will also mention in the next slides, are actually very critical because we need to consider very carefully the local context and the local culture. Okay. Now we will focus with one of the projects that actually this systematic review implemented. That is actually one of the projects that we developed here is actually now is quite old because we began this project in 2016, and actually this is the first project of artificial intelligence being applied here in Peru. This project was supported by the National Institute of Health. We worked this with collaborations from the United States. This was a grant initially granted to UMass Lowell, and then the main researcher, Dr. Mahu Brunet, then she moved to another university, but she continued coordinating the project. Our local partners here in Peru, we worked this project with the Ministry of Health, with an NGO, Partners in Health, which is actually this organization also has offices in the United States. Paul Farmer founded this NGO. And also with the academia, here a couple of universities participated, Continental University and Universidad Peruana Cayetano Heredia also participated in this project. Actually, it was a very collaborative project. They have several phases. I'm not going to going all to this process, but this involves also quantitative studies and qualitative studies. And this also a very important also recommendation when we evaluate artificial intelligence solutions. All the quantitative studies are very important. These help us to validate the algorithm first. At each point, when we published the paper about the validation of the algorithm, we got around 90% of precision, which actually was one of the highest precision in all the papers back in 2016. Now, during the pandemic, then the algorithms also and all the evolution and developments of AI also, we actually look also with many other papers that are actually show better results, but back in 2016 was a pretty very good results for a precision of the validation of the algorithm. And then we validate with the healthcare professionals. The idea was very simple. As we mentioned in our first slide, we lack of healthcare professionals. We lack healthcare professionals in most of the regions in Peru because our medical doctors are concentrated mainly in the capital, in Lima. But if we travel to other regions, could be in the Andean regions or could be in the jungle regions, we lack a specialist. We might have a general physician that is working in a rural area, but of course, they don't have all the experience as a specialist. So, given the high penetration of cell phones, right now, or pretty much all physicians have at least one cell phones that have internet capability. What the idea was to use a cell phone so they can take a picture of the X-ray and then an algorithm embedded in an application. They can suggest one of the diagnoses or one of the patterns that can be suggestive for a tuberculosic pattern. So that can be used for that can a general physician can use, or even a nurse can also use this device. We created a repository. We also validated with pneumologists in the US and in Peru. And this is also a very important feature of this project as well. All the digital X-rays were from Peruvian patients. So were patients that were were attended at the healthcare center by the Ministry of Health, and all the patients that also visit the clinics at Partners in Health. So all the data, obviously our body of knowledge and all the data from the digital X-rays were from, we have a group of people with tuberculosis and normal people. So actually that way we train with our data the algorithm. One of the key components of this project, and in any project actually, when we consider working with artificial intelligence, we not only need to take care about the technology, the application, the system, but also, as I mentioned before, the process. We need to map very carefully the process, and if we need to improve the process, if we need to change the process, well, we need to do it before we implemented a technology. Otherwise, we can have the best technology, we can have the last cutting technology, but we might be informaticizing the cows. We don't want that. And we need to take in consideration all the ecosystem about the workflow. We need to take care about all the organizational factors, the physical and social factors, and all the mental and physical duties that a health professional has to do. And considering all of that, then we might improve the result of the patient, and we might improve the results of the organization as well from a public health perspective. The artificial intelligence, in terms of policies, the Ministry of Health has considered artificial intelligence in the national health agenda for the healthcare sectors. Well, this slide is in Spanish, but basically what it says in one of the points is that the objective of this digital agenda is to implement systems based on big data and artificial intelligence to analyze in real time and to improve the efficiency of the public expenses and to improve the quality of attention of the healthcare services. So this is still ongoing because the Ministry of Health just passed a kind of extension until 2030. Now that I'm finishing my presentation, I want to address 3 points, 3 last points. One of the important points is building capacity, and this is a much needed issue in Latin America. Still, our universities, with a few exceptions, but most of the universities in Latin America are not including and are not developing artificial intelligence or digital health programs, with a few exceptions. Obviously, Brazil is an exception. It's a huge exception. But in most of the countries in Latin America and the Caribbean, we still need to build capacity and training programs for digital health and for artificial intelligence. We are facing a lot of challenges to do that, but one of the important point is to build collaborations, and that's why I invite you. You have some programs that you like to collaborate with some of the regions. We will be more than glad to talk, because this is a very important issue. We need to strengthen capacities for multidisciplinary programs to apply data science or artificial intelligence programs or digital health programs in Latin America. Here we're showing you an example of a program that we developed here in Peru. We published the evaluation in International Journal of Medical Informatics. We published also some of our views and our analysis in the Journal of Medical Internet Research. So this is a very important part. The second point is that we still need to face some of the challenges, but also that are opportunities. So one of the big concerns when we deploy artificial intelligence solutions are the ethicals, all the confidentiality and the privacy issues. We have several guidelines from different organizations about the importance of the ethical considerations. Also, confidentiality issues are critical also in our countries, in part because we still don't have strong security measures and considerations in our systems. So we need to work a lot on confidentiality and privacy issues. Policies and governance, as I mentioned, is important from the government role. Interoperability and data standards are a critical role as well. Evaluation. Evaluation is one of the main important components also when we deploy and when we evaluate artificial intelligence solutions, because each country have their own regulations instead of data. We have our own data standards. We have our own way to represent diseases. Still, in Peru, for example, we use the International Classification of Diseases by the World Health Organizations, but other countries use other standards to classify diseases, and those are very important to consider before deploying an artificial intelligence solution. Evaluation, as I mentioned, is very important. Unfortunately, still in Latin America, we don't have much culture for publication. We don't have much culture for documentation. We don't have much culture to publish scientific articles. But this is also one of the competencies that we need to boost and reinforce in our healthcare professionals. Obviously, all the cost studies and the sustainability and scalability are going to be a huge issue, and that's why mainly why in this systematic review of 2021 they just selected 10 papers, 10 papers, just 10 papers, because most of the developments in Latin America may stay with pilots or may stay with a very focal solution that have been developed. Capacity building, as I mentioned, the technological infrastructure and the internet will still be a huge issue. Besides, as I mentioned, we may have good internet connectivity in the main cities, in urban areas, but rural areas are one of the most needed, not only for healthcare, but also for technology. If we need to do good telehealth, we need good internet connectivity. And the e-health literacy that I mentioned that we still need to develop and work with patients and the general public. And this is my final slide, which is kind of a call to action for strengthening health information system and artificial intelligence solutions in low and middle income countries. So first, I'm not mentioning technology. First, I mentioned the socio-technical factors and culture, because are crucial for health information systems. As I mentioned, we might have good internet connection, we might have good software, we might have a good artificial intelligence solution. But if the director, if the minister don't have the vision, then they will block or they will just pass or they will not work on these important issues. So addressing socio-cultural issues might enhance the health information system effectiveness. Investment in training and capacity building, a lot. We need a lot. We need programs developed by local universities in partnerships with international universities. Successful case studies provide valuable insight. Those 10 experienced 10 papers in this systematic review actually are good case studies because we can learn what worked well and what didn't work. The engagement of the diverse stakeholders and communities, involving the stakeholders is important. The public sector should work with academia to develop these artificial intelligence solutions, and we need to involve the communities, because each community have their local culture, each community have their local issues that need to be considered, and we need to take in consideration as soon as possible the user's feedback, the user's needs, in order to develop the best solution for each of the specific needs that they have. The continuous monitoring and evaluation for improvement and promotion of global collaboration and support. Yeah, we need global collaboration and support, and that's why these kind of opportunities that I am here as talking and exchanging some of the experience and some of the opportunities also that we have are very important. And with that, I really thank George and all of you for this opportunity, and I will be looking forward if you have any questions. Thank you so much, and I hope you can visit Peru, and this is a beautiful picture of Machu Picchu. So I hope we can see you very soon. Thank you so much.
Thank you, Walter, for this great presentation. I want to remind our attendees that you can use the Q&A feature to post any questions for the speaker. And in the meantime, I think we already have some questions, but I wanted to ask you first, in terms of deploying AI solutions in low and middle income countries, do you see a challenge in terms of how we can ensure that that deployment addresses the local needs, the local priorities, the local disparities, rather than reinforcing potentially existing dependencies on high-income countries' technologies or infrastructures or different value systems.
Mhm. Yeah, we are actually is an issue that we are facing right now, George. That's why I'm very focusing and repeating this important issue of taking the needs of our final users first. Not only about the needs, about the needs of specific features that a patient might need or might want to see first and so, but also the specific needs based on the regulation of each country. No? As I mentioned, if we bring one application from other country, that might be one country even in Latin America. We use different way for classification. We use different ways to name diseases. So one disease might be known in Mexico, and the same disease is different, or we use a different name in Peru. Um, Also, in terms of treatments, we might have a decision support system that use U.S. protocol or is based on the American guidelines or European guidelines. And unfortunately, in Peru or in other of our Latin American countries, we don't have and we don't share the same medicines and the same antibiotics and so on. And that's very important that an artificial intelligence solution or even an electronic medical record might consider the local guidelines, no? the, the clinical practice guidelines from each country. And also, this needs to be taken in consideration not only because of the regulations, not only because of the standards, but also because of the culture. So those are different conditions that we need to take in considerations uh, 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 when we are considering, for example, bring an application from another country and try to adapt in our country or in our setting. Mhm.
Thank you. We have a question, talks about the excellent presentation and asks if there's any use of complementary or alternative medicine, herbal traditional medicines in Peru, and how would e-health records integrate such information shared by patients, if at all?
Mhm. Yeah, this is a very good question because still in countries like Peru, if a patient, I'm talking about a regular patient, if a regular patient feels sick, an important number of patients, they don't go to the doctor first. They go to a pharmacist first because this is trying to change, but still you can go to any pharmacy in Peru and you almost can't find any medicine, even antibiotic, without prescription. This is changing now, and I'm glad of that. But still, that happened here in Peru and many other countries in the world as well. So this is very important because, automedication is a huge problem here in Peru. Also, other patients, in fact, and it's real that they go to an herbal doctor or a doctor that can prescribe some plant. And there are very good plants. We have a lot of evidence which some of the plants are really effective to treat different kind of diseases. This is being used and in all Peru, and each region of Peru have certain plants that actually are very good for certain diseases. Um, and and yeah, this is being registered in, or this should be registered in the medical record. and could be electronic medical record or could be a paper-based record. But I can say that the most of the benefit for implementing the electronic medical record is that we already know that some herbal treatments or plant-based treatments interact with some of the medication. And that could be very good if we develop, for example, an internet or artificial intelligence component integrated to the electronic medical record to show, for example, medical alerts. So the physicians can say, oh, I didn't know that this plant could interact with so-and-so medicine. So that would be very good. And also, in terms of developing, for example, apps to give information or to provide information to the patients, also those kind of alerts or those kind of warnings can be sent as text messages or even interacting to a chatbot via WhatsApp, for example, because WhatsApp still is very well used in all Peru. I think all Peruvians with a cell phone has WhatsApp in their devices.
Thank you. I guess one last question. Do you engage patient partners in your planning in terms of them being co-authors of your research, or perhaps even more broadly, as we talk about decisions for deploying AI tools in clinical practice?
Oh, very good question. Well, engaging patients is very important. Some in my papers particularly, no. We certainly do a lot of qualitative studies and engage patients and engage patient empowerment, but it might be in some cases. For example, when we are working with group of patients, if a patient or if the coordinator of this patient coordinator also has significant or a significant role designing the project or implementing the project or evaluating the project, yes, we can consider as a co-author, and they should, because if they meet the criteria for being recognized as an author, a patient could certainly be a co-author of a publication, and I think that could be very positive. Yes.
Somebody's asking, what is the Spanish word in Peru that's used for the patient's family caregiver?
Oh yeah, it's familiar. I can type here in the yeah. So this is a very used word, no? It's the familiar, which is the caregiver of the patient, no? Which also has a very important role as well, because especially for older patients.
Well, thank you so much, Walter, for this great presentation and great discussion. If there's more questions, please feel free to contact Dr. Curioso directly. And just a reminder that the recording of this webinar will be posted on our YouTube channel, hopefully within the next 3 to 4 days. So you'll be able to also see the recording there. This concludes the webinar series for this academic year. And we will start again in the fall, in September, and stay tuned for announcements for our 2025-26 webinar series that will start in September. And so with that, I want to thank again Dr. Curioso and thank all of you for attending.
Thank you so much. Bye-bye.